Pain doesn't feel good. And it's sensory and emotional. Grief is pain. Heartbreak is pain. We're not just talking about physical, we're talking about our experience as humans. So I have the exciting role of talking about pain management, which, it is NF specific, but let's be honest, everyone experiences pain. So I'm hoping even if you're here today and you don't have NF, that you might be able to get something out of today, because, learning to manage pain is something that we all need to face in our life. But first I'm going to cover, what is pain? And that's a really good question. Does anyone have an answer for me? What is pain? Anything? No one's experienced pain? Well done. You can all teach me. Pain is unbearable. So it's unbearable. Yeah, okay. Trying to get rid of it. Yeah, Helen?
Very isolating.
It's isolating. So it's experiencing it's maybe separating you from other people, from things that you'd like to do. So it's impacting your quality of life. Anyone else? What is pain?
Signals in the body.
Yeah.
Indicating that maybe something's wrong. Perhaps.
Yeah. So signal is coming within your body. It's it sounds like people are saying it's an experience. So let's quickly look at what the official people who define pain, the International Association Study of Pain, so they're the guys who know what they're talking about. They say it's an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. So I think there's a lot there for us to unpack today. And so as some people said, it's unbearable, so it's unpleasant. Pain doesn't feel good. And it's sensory and emotional. Grief is pain. Heartbreak is pain. We're not just talking about physical, we're talking about our experience as humans. Can be painful. And it's talking about actual or potential. So I don't know if you've ever hurt yourself and then you almost can't look at what you've done, because what's happened, and then you look and it's oh, actually I've just bent my nail back, but gosh, it's painful. It's that what's happened. It's potential. It isn't just actual. Is that one not working so well? Okay, thanks Marcus, he's on it. Brilliant. But how about if we didn't have pain? Would that be good? If you just someone said, I've got a magic wand, I'm just going to get rid of all your pain, you'll never experience pain. Would anyone be up for that?
No.
Some people, no. Why would you say no?
You wouldn't know if you hurt yourself.
Because you wouldn't know if you burnt yourself.
It's a signal that something's wrong.
It's telling your body that something's wrong. Exactly. So I've got a little picture here of someone, bless him. There is actually a condition that you can have where your body doesn't experience pain. The problem is for people who have that condition, they don't live very long, because as you might be able to see, he's lost some of his limbs, he's got some burns and stuff. Is because if we're not getting our signals telling us that something's wrong, we're not going to know. We're not going to know to not touch the kettle again. We're not going to know not to walk on a broken leg. So we need pain as much as we might not like it. It has a purpose. So some of you mentioned the purpose already. So signalling that something's wrong. It protects us. If I've broken my leg, when I was little, I fell over, broke my leg, and my mum just thought I was being silly. So she was like, get up, just walk. And I was there crying, going, I can't, it's so painful. Because it's trying to protect me from doing more damage. If we get that, we're like, oh, there's pain, I need to stop. And so that is what it's meant to do, is to help us. It tells us when something is wrong. If we didn't have pain, we wouldn't know that there was something wrong in our body, something that might need to be looked into or investigated. And what's really important is that pain is connected to our memory. So especially when we're children and we're learning, you learn about heat for the first time. You might touch the oven even though your mum told you not to. And that painful experience gets seared into your memory as well as your hands. And so that you won't do that again. Because you go, oh no, I remember that was really painful. So it's really important that it's going into our memories to remind us of harmful things that have happened. So most pain that a lot of us will experience is acute. So that means, it's happened, it's got an easy explanation. As I said before, an example of a broken leg, that's acute. It's a very obvious cause of my pain. And then the solution, we go to hospital, I get it in a cast, my bones heal up, and then I'm back to walking normally. So it is usually the result of tissue injury or inflammation. So again, I might, do my back in, get very pain, you can get nerve pain from doing your back. And then hopefully with some physio and the right medication, after a while, I should be back to be able to do my usual exercise. And one of the things that's really important about acute is that hopefully with the right treatment, we can fix it. And then your pain goes away, you can go back to life as normal once the inflammation or once the bones have healed. And then what sort of things could we do to help acute pain? What sort of things might you do? If you had acute pain, what would you do? Yeah, so you rest it. If I've broken my leg, I'm not going to be going and playing soccer, am I? I'm going to need to elevate it for a bit. I'm going to have to rest it. What else?
Take painkillers.
Yeah, so what kind of painkillers might I take if I've got acute pain? Paracetamol, classic. We all go to that. I've got a headache, I'm just going to take some paracetamol. Any others? These aren't trick questions,
Ibuprofen.
Yeah, ibuprofen, cocodamol, tramadol, yeah. We'll get to pregabalin in a bit. Morphine, if I was really in a bad way, we might give me some morphine. So they're all great solutions, or put the leg in a cast if it's broken, so that you don't move it around. So for an acute pain, or I might need to take some antibiotics if the acute pain is because I've got, an infection. All those things are really good in a short period of time. And when we talk acute, we're talking less than 3 months. So taking paracetamol or taking morphine or resting, for 3 months, that's fine. That's okay. It's not great, but it's okay, and then hopefully you get better. But if the pain doesn't go away, then we're going to have to rethink things. And that is when we move into chronic pain, which for a lot of people with NF, in my role, that's what I'm trying to support people with. Because if the pain doesn't have a clear reason, or the clear reason can't be resolved easily, then we need to rethink how we're managing this pain. So chronic pain is longer than 3 months. It's continuing without obvious injury. And once it's reached over 3 months, it becomes a condition on its own, in its own right. And that's why we have, entire units who deal with chronic pain, because it is a disease in its own right. And it can't always be easily explained. I think that can be quite difficult when, our approach to acute pain is that it has a very clear start and it has a very clear finish and it has a very clear plan of how to get there. With chronic pain, it's not always that easy. And I think that can be quite difficult when we're looking for that why. And that's part of my role, is to help people that sometimes we won't always know why, but we can still work at managing the pain instead. So I'm just going to quickly get onto NF1 specific. So sometimes people have pain because they've got a neurofibroma, and as we know from, Prof. Werner's talk earlier, neurofibromas, they're lumps that are sitting on the nerve sheath, so they can press on the nerves. Nerves are quite sensitive, they don't like being pressed on, and they will let you know about it. And so you might get symptoms. And so sometimes if it's a little lump or it's in an area that's easily to operate, we can sometimes refer you to a specialist team who can do that. And sometimes people get really good result and they won't have pain. But sometimes actually that can make the pain worse, and then we're dealing with the pain on a nerve with nothing we can do about it, but that's a different story. So sometimes we have lumps that are on nerves, we can't operate on them, so we need to think differently about how we then manage the problems that they're causing. And as Professor Fenner said before, if you have a lump on your nerve that is sort of kind of bigger than a marble, and it is growing rapidly, it's changing in texture, it's causing you some nerve symptoms like tingling, weakness, numbness, pins and needles, please seek help and seek help quickly. Don't just think, oh, it might just get better. Please seek help. And even if you're not under the complex NF service, the nurses were really happy to take calls on the phone. So, if you want our number, do come grab me. We're not an emergency service, and Nerve Tumours UK also have their helpline. Don't leave something thinking it's going to be okay. Just, it's better to ask, right? And then it's all good rather than to just leave something. So, treating chronic pain. We can't cure chronic pain, and that's really hard because we want to cure, we want to get better, we want to get back to our day-to-day life, and we don't want to live in pain. And so part of our role is trying to help people change that mindset, where things with acute pain and things that can work with acute pain over 3 months, they can actually be really unhelpful. So we want to help people to improve their quality of life, to maybe get back to doing some of the things that they used to really enjoy doing, even though they still have the pain. And that is part of our role and what we're looking at. So there are many ways we can help people with chronic pain. Obviously that treatment depends on intensity of pain and what the pain does to your quality of life. And so some of the things that we might think about was, with the acute way of treating pain, if someone wants to remind me, if someone said rest, okay, so why would rest then not be helpful after 3 months? Any thoughts? Yeah, you become unfit. And, if you're not moving your muscles, then when you do, your experience of pain is going to be increased. Any of the other strategies that we were using that wouldn't be helpful?
Long-term drug treatment.
Long-term drug treatment. So the medications that we're using in an acute period are great, but over a long period of time, they can start causing a lot of problems. And I was chatting to someone else earlier today who was saying, when they were on, long-term opioids, they had to start taking other medications to sort out the problems that the opioids were causing. We don't want people getting in that sort of position. And so some of the things we look at is, self-management. So there's a lot of different tools that you can access online to try different strategies to help manage pain. The medications that we're going to look at, they work in quite a different way to the medications that we use for acute pain. Physiotherapy, so, any pain team in the country will have a physiotherapist because movement is so important as part of management of chronic pain. And then psychology, which I'm going to touch on quite a bit at the end. So self-management, I don't know if anyone's heard of the Pain Toolkit. It's quite a good online resource. It's got videos on each one of the tools. They've got 10 tools for self-management. And so it's ways that you can help yourself go online, find some resources that might be helpful. And that's quite good if you've got chronic pain, but you're still managing to do a lot. you might not need to have, you know, a big specialist team helping with your pain. You know, if you're still managing to get to work and that sort of thing, this might be a really useful resource just to give you a bit more knowledge about chronic pain and understand, you know, simple things like pacing yourself, getting people around you to support you, thinking about motivation, and, you know, thinking about stretching and exercise, that sort of thing. So every tool has a video that you can watch online, and it's quite helpful. So medications, which is one of my biggest passions, because I speak to a lot of people who are on long-term opioids, and when they come and see our pain specialist, you know, one of his first things he will try and do is reduce your medication, which, you know, can be quite confronting if you've been on medication for a long time, but we have to ask ourselves, you know, is this working? If you're still coming to us saying you're in pain, then obviously all these medications, they're not doing what they're meant to be doing. So some of the medications that, you know, we might try and reduce you is things like paracetamol, ibuprofen. You know, Professor Fenner mentioned previously, a lot of people that we see have chronic headaches, and yes, headaches is really common in NF, but sometimes it's because of the medications you've been on that are actually causing the headaches. So instead of trying to throw lots of headache treatment at you, let's try and take a step back and put in some just normal lifestyle strategies and see if that helps first. So what is some medication that you might use long term? Someone said it before.
As a pregabalin.
Pregabalin, yeah. So that is one that we use a lot. There's one very similar. Yes, amitriptyline, and gabapentin. So they're all a little family of drugs that we use a lot in NF. So they are nerve pain specific medication. You might read up saying, oh, they're used for antidepressants, that sort of thing. They used to be, but the main use for them in NF is for pain medication. And the way they work is quite different to like paracetamol, morphine, all them, where you're in pain, you take medication, it should make you feel better. These ones, you've got to think long term. So the first month, you might not get much benefit from them, which is really hard because that's also when you have the worst side effects. So people call me up saying, I've been taking gabapentin for 2 weeks, I feel rubbish, and it's not working. I'm saying, please keep going, because after a while, the side effects should hopefully wane down a bit, and you should start getting some benefit. So they do need to be taken regularly. They also do come with side effects, unfortunately, and some people, you know, do call me and say, look, I've been trying amitriptyline, it kind of helps with my pain, but I just can't handle the dry mouth, and I've decided I prefer to have pain and think about other strategies, and that is their choice. I had one lady say, look, I've tried gabapentin, I gained a ton of weight, I'd prefer to manage the pain in a different way and not gain weight, and again, that's their choice. So it's about a partnership. You know, we're not going to come and just say you need to take all this stuff. We want to have a conversation with you about what's working, what's not working. You know, if you've got a job where you need to be really on the ball, then some of these medications that make you feel a bit drowsy might not be a good option for you. So it's about having a conversation with your clinician and making sure that the strategies that you're using, and if it is to have some medication, that it is going to be practical for your life. So physiotherapy. In our complex service in London, we're really happy that we have a physio who sits in my office, and we've got a psychologist who sits in my office, and that's because when we're looking after anyone who has a chronic illness, we want to look after the whole of you and recognise that NF can cause, you know, pain, and it can cause, you know, changes in your mobility and how you feel about things. So our physio, you know, they're going to work with you to increase your exercise ability, because if you've had pain and you've been guarding and not maybe using your body as you used to before you had pain, that's going to impact on the way you walk, it's going to impact on your alignment, it's going to impact on your muscles and how they're working. So a physio is a really helpful member of your pain team, to help give you those exercises to maybe strengthen areas that have been weakened and maybe help realign you. So one of our pain doctors was telling me about a research they've done that's also shown that if muscles are being used, they've got a higher exercise tolerance, their pain tolerance is actually higher. So if you are struggling with pain, one really good way of increasing your body's pain tolerance is to increase your exercise tolerance. So even though starting an exercise regime when you're in pain can be very difficult and can sometimes feel like the pain is worse because you're using these muscles you haven't used for a while, if you persevere and you're doing it with a physio, I don't recommend just going out and trying it on your own, but if you're doing it with a physio and they're giving you the right advice and the right exercises to do, then over time you should notice a difference in your pain management. And psychology. So some people get a bit nervous when I talk about psychology in regards to pain. And they're saying, oh, Mary, you think it's all in my head? Absolutely not. Pain impacts your life. As Helen said earlier, isolation, it impacts your ability to go out and socialise with your friends. It impacts your ability to work. It impacts your sleep. If I'm not sleeping well, I'm going to be grumpy. So if you're not sleeping, it is going to impact your mood. And so the psychologist is such an important part of our pain team because they're going to help think about, maybe your beliefs around pain as well. If you're believing that you can't walk somewhere because of the pain, then you're not going to, be doing all your physio exercises because you're going, well, actually, I believe that this is going to make it worse. So they can work with you about your beliefs around pain, your beliefs around movement, but also help you in your approach to your pain. So please, if anyone ever suggests seeing a psychologist, you just say, yeah, I'll give it a go. Like, they are, part of the team. They're really skilled. They've got tools that they can give you. And if anyone is part of our complex service and have met Susie, she is one of the nicest people that we have in our team. Whenever she comes in, you're like, oh, it's okay, Susie's here. It's going to be a good day. Because, it's really important. How we think will impact how we feel. And that is one of the classics of the psychology model, is if we've got thoughts around our pain, it's going to impact how we experience our pain. And that's what we want to address. So if you have gone through all those strategies already, you might get referred to a pain management program. And I'm aware that there's a really good one in Bath. There's also one that we're linked to at St Thomas's in London called Input. And this is where maybe locally, if you've been under a pain team locally, you might see a pain psychologist, you might see a pain physio or a pain nurse or a pain doctor. Where here as our pain management programs, you would come and actually stay, maybe for 2 weeks or 4 weeks, and every single day you'd be getting teaching, you'd be seeing a physio, pain doctor, the nurses, the psychologist, as a really intense time of getting your pain management sorted. So they will take referrals from outside of London and outside of Bath, but it needs to come from a local pain unit, and it would be once you've already tried all the different pain strategies that is available to you locally, that then they would refer you here. For those who are already under the complex service, we just refer you straight because you're under us already. And part of why these have been made is because pain is not easy to deal with. It's not easy to manage, and you need a whole team behind you to help you and to bring you, back to a quality of life, that might not be what you had before, but something that is hopefully better than what you're with at the moment. So, psychological strategies. Which Diana mentioned a bit before, which I was really excited that she's touched on them already. So if you do see a psychologist, they might specialise in some of these approaches. Cognitive behaviour therapy, if you've ever heard of that one before, is probably the most common when you see a psychologist. They, just see if I can flick through. Here we go. So when you're meeting with a psychologist who specialises in cognitive behaviour therapy, they will usually have this model where, I don't know if you can read it, so I'm going to come and point to it for you. So we've got up here, we've got behaviour, physical sensation, thoughts and emotions. And when you're seeing a psychologist, they're saying all of these things are impacting on each other. So your physical sensation of pain, that's going to impact your behaviour. Maybe you're not going out as much, maybe you're not seeing your friends, maybe you're not being able to get to work. And that's going to impact your thoughts. You might start feeling like, what's the point in going on? I'm so fed up with this. I hate getting out of bed in the morning. And that's going to affect your emotion, because then you're going to feel really maybe sad. You're going to feel low. You might start feeling really angry or frustrated. So all of these things are going to impact on each other. So what cognitive behaviour therapy does, it believes that our thoughts can change. We can restructure our thought patterns. And we can do that by challenging our thoughts. And one of the strategies or tools that I took from that, one of my favourites, is taking my thoughts to court. So say if I had a thought about pain. So a common thought that I will get if I get, let's use an example. Okay, say I get breast pain. Sometimes if I get breast pain, I'll instantly think, oh my gosh, it's cancer. And that is a very scary thought, because something like, and you might get that with your lumps. If one of your neurofibromas suddenly becomes painful, it's like, oh gosh, it's become cancerous. What am I going to do? And that's a really scary thought. So then what cognitive behaviour therapy would do is say, okay, well let's take that thought to court. So instead of me becoming really scared about it, let's question it, let's explore it. Let's say, okay, well what's the evidence for that? Do I have a lump there? Is that known? And you go, well maybe it's not known and there is no lump there, so maybe that's okay. Or maybe you might say, well actually there is a lump there, in which case, instead of getting worried and panicking by myself, I should call one of my specialists. So see how it's kind of, instead of staying in that moment of being really fearful, it's actually taking a step back, thinking about that thought, and then changing that thought, if that makes sense. So some people really like cognitive behaviour therapy. Some people have not got on so well with it. And if that's the case, you might find acceptance and commitment therapy a different approach and one that might work for you. So again, as clinicians, we can present options to you, but it is a partnership. So if something doesn't work for you, you're not going to use it. It's not going to be helpful. So it's about us trying to find an approach that's going to work for you. So acceptance and commitment therapy, or ACT, as Diana was talking about before, that's looking at our thoughts, and it's thinking, well, our thoughts are there and they're allowed to be there, because thoughts are just strings of words. And in some way of thinking about it, it's almost like a channel that you listen to. You've got on a radio, you've got all these different radio channels going on, and you can tune in to which channel you want to listen to. And so that doesn't mean that maybe one of my channels is, I feel really rubbish today and I hate how I look and no one wants to listen to me. And that radio can just keep playing. And I can say, well, I don't have to tune into that one. It can be going, it's allowed to be there, but I'm going to tune into a different radio that says, actually, I'm doing okay. And you know what? I got out of bed today and I actually got dressed and I actually had a shower. So you know what? Today's going okay. It doesn't mean that the other one isn't there. It just means I'm not tuning into it. And so some people prefer that strategy. I quite like that one because it talks about, defusing us from our thoughts. So where CBT is thinking about restructuring our mind, this one is thinking our thoughts are there, but we don't have to agree with them, or we don't have to get stuck with them. So if I have a thought, say, I feel that I look really rubbish and that everyone thinks I'm really ugly. And if I am having that thought and I'm believing that thought, it might affect how I talk to people, it might affect how I dress, it might affect if I go outside, because I might feel really low and, you know, it is just a thought. And so ACT would say, well, let's try and remove ourselves from that thought. So ways of doing that could be you say to yourself, and it might be that you say it out loud or just in your head, I noticed I'm having a thought that I look really ugly today. And instantly by saying, oh, this is a thought, you have removed yourself from it and you're suddenly giving yourself a bit of distance and a bit of perspective. So give another example of a thought would be, say I'm walking home and I'm by myself. I might think, someone could come and get me. And I live in central London, that is potential, no. But it is, you know, that's a thought. CBT would say, let's look at the evidence. ACT would say, okay, that's a thought. Let's think about, if I have that thought and I'm believing that thought, what might start happening to my body? And Professor Werner mentioned about adrenaline earlier. You know, my body's going to start producing a lot of adrenaline because that's our fight or flight response. You know, if I'm in fear, I'm going to want to run. So what else might start happening to my body? My heart rate might go up. My hands are probably going to start to get quite sweaty. I might start having problems breathing. You know, it's going to have a really big impact on my experience, my physical experience, just because I've had this thought. So ACT would then say, okay, let's try and diffuse you, let's try and remove you from that thought. So I could do that by saying, I notice I've just had this thought, but it's just a thought. Or some other tools, one of their strategies for diffusion is to then sing in your mind that thought in like a really silly song. So you might say like to happy birthday, like there's someone comes to get me. And then as soon as you do that, you're suddenly like, that's ridiculous. And it's just to remove that some fear so that my adrenaline levels lower, my heart rate lowers, and I'm able to actually remove myself from that thought and think, that's just a thought. And I can continue walking and hopefully not feel scared. Does that make sense? So there are two approaches that are quite helpful, but it's just finding which one works for you. And people tend to click with either one. So it's finding which one is right. Linked with ACT is mindfulness. And I've put two of my favourite apps down the bottom there. I don't know if anyone's heard of Headspace or Calm. I'm a very big Headspace believer. They help me get to sleep most nights. So mindfulness is a sort of a meditation technique to help us be present. So often our worries, especially if you're experiencing pain and you've got a lot of fear around pain, our minds can either go backwards of what's happened previously, or they're going forwards of worrying about what's going to happen in the future. And what mindfulness tries to do is anchor you to the present. And one really easy strategy of doing that, if you notice your mind is starting to go off and get really worried, is to focus on your breathing. So really simple thing to do, say you're waiting for your appointment and the doctor's running late or whatever, is to just focus on your breath and just take 5 really big deep breaths and just stay in that moment. Because you don't know what's going to happen once you've had the appointment, or you don't know what's happened previously, and that's affecting you. But mindfulness tries to get you to be fully present. And by doing that and focusing on something other than the pain we're experiencing or the fatigue we're experiencing or whatever thoughts are bugging us that day, it's to try and refocus our attention on something else and something fairly neutral. So we are going to have a bit of a mindfulness time. I'm going to get you guys to do, if you're all up for it, a mindfulness technique with me. So you can read those guys a little bit later. Mindfulness is really helpful because you practice it. So if you just do it once, it might be a bit weird for you if you haven't done it before. But if you start putting it in regular practice, it can be really helpful because you start bringing it into just your day-to-day life. You don't even have to have your eyes shut to be mindful. One of my friends who struggles with anxiety, if she notices that her anxiety levels are starting to go up, she'll just mindfully drink a glass of water. And that's, no one else needs to know that that is what's going on inside of her. She is just fully focused on, what does that glass feel like? What does the water feel like when I drink it? Is it cool? What's my breath like when I'm doing this? She's just being fully in the moment to try and defuse the anxiety levels that she's experiencing. So it doesn't have to be, if you're getting stressed and saying, I need to practice some mindfulness, you don't have to go and sit down somewhere and, take deep breaths and shut your eyes and meditate. It can just be anything that you're doing at any time that you're just being fully present doing. So, you're all sitting already, so that's perfect. I'm going to get you all to shut your eyes and have your feet firmly on the ground and your arms just comfortably in front of you. And this might be, new or different for you, and that's okay. So just be aware of those thoughts, even if they are thoughts of, this is ridiculous. Just be aware of those thoughts and come back to your breath. I'll take a big deep breath too. So let's give it a go. The first step is to become aware. So check that you're sitting with a relaxed but upright posture. And the process may be easier if you close your eyes. You can do it with your eyes open, but closing your eyes can help you to connect with the experience most fully. Now bring your attention to your inner experience. Gently bring your awareness to what you're experiencing. Ask yourself, what am I experiencing now? Right at this moment. Gently draw your attention to any thoughts going through your mind. Try to watch and observe these thoughts. For example, you may say something to yourself like, I'm aware of anxious thoughts. Or whatever the thoughts are for you. Whatever the thoughts are for you, try to accept them as just mental processes. Thoughts that are simply happening. Without trying to change them or getting hooked into them, draw your attention to any feelings that you are experiencing. Whatever these feelings are, even if they are unpleasant or uncomfortable. Perhaps saying to yourself something like, I'm aware now that I feel sad or angry, or whatever the feeling is for you. Simply try to accept and acknowledge these feelings just as they are, without trying to change them Now gently draw your attention to any sensations in your body. Scan your body and notice any sensations. Pleasant, unpleasant, any sense of tension or discomfort. Just acknowledge these sensations without trying to change them. Perhaps saying to yourself, "That's interesting. I'm feeling a tightness in my shoulders." Or whatever the sensation is for you. Just acknowledge these sensations without trying to change them. Now gently move your focus to your breathing. Really focus on your breath. The sensations of your breathing. The sensations of the breath from when it enters your nose, when you start to breathe in, until you breathe out. Become aware of your breath traveling through your body. The sensations, the movements of your abdomen and chest. If your mind wanders from the breath, gently bring your attention back to the breath. Use your breath to anchor you in this present moment. Now expand your awareness to include your breath and a sense of your total body, all aspects of it. Notice that it is your whole body is being breathed, is breathing, softly, gently. If any feelings or sensations of tension or discomfort emerge, imagine your breath moving in and around those sensations, accepting and embracing them, gently exploring them without trying to change them. When their presence becomes less noticeable for you, gently and softly bring your awareness back to your total experience in the present moment, to your body, your thoughts, the environment. Then, with your eyes open, sitting here in the present moment. And when you're ready, you can open your eyes. I hope some of that might have been helpful. It might have felt a bit awkward for you, or it might have been something that you've done before.